They were actors, teachers, scientists, bartenders. And they were those who never had a chance to be anything. In the end, they were all victims of AIDS. In a way, we are all victims of fear and private anxiety.
I'm just wondering how certain that medical evidence is that the virus can't be transmitted in school as much as a common cold can be.
Worry about AIDS is part of being a parent now.
What we really are gathered here today for is the welfare of our children.
Anxiety stalks those who meet the public every day.
And we're talking about the transference of money and other things back and forth, you know. Is there any likelihood that AIDS can be transmitted in this fashion?
Police, firemen, hospital workers deal with their own fears.
This is a pocket mask that goes over the nose and mouth of a victim. The resuscitator would blow through the opening here. This would avoid the mouth-to-mouth contact.
The threat alarms dentists. Everyone agonizes over blood transfusions.
My husband had surgery, and when we were asked if we would accept blood if the need should arise, we denied it because of the fear of AIDS, and we wonder if that was the right choice.
Even some of the faithful are frightened about receiving communion from a common cup. A new year begins, and concern about AIDS spreads throughout America.
I'd like to know what steps an average American can take to avoid contracting AIDS.
A sizable majority of Americans believes that no segment of the general population will be spared AIDS, that all of us are at risk. 76% said so in an NBC News Wall Street Journal poll released just tonight. AIDS is on the minds of just about everyone. 3 out of 5 people say that they have heard or read about it a great deal, about victims disowned by their families, about soaring medical bills, disability payments, and lost income. Well over $6 billion to date, and 60% of that public money, jobs that are lost, school doors that are closed to some children, the conflict between public health responsibility and civil liberties. We also know that all the laboratory tests, all the technology, have not prevented a single AIDS death.
This is an NBC News special report. Life, Death, and AIDS. A national forum. Here again is Tom Brokaw.
Good evening. Tonight we deal with a plague called AIDS. What is precisely known and not known about AIDS has sometimes been distorted, magnified, discounted, leaving many people uncertain and confused. An NBC News special report on AIDS last November drew more than 20,000 letters. The most asked questions: am I at risk? How can I protect myself? Should I be tested? And we also heard this: it's what they don't know that bothers me. Well, it's our hope on this program tonight, as much as we can, to demystify this disease. And we have assembled the leading experts in the nation to answer your questions about AIDS and casual contact, about AIDS and blood transfusions, what is safe sex and what is not, who gets AIDS and why. To answer those questions and others, standing by at the National Institutes of Health near Washington are Dr. Robert Gallo, who identified the AIDS virus and is leading the fight to find a cure, and Dr. Samuel Broder, who runs the clinical drug testing program. Dr. Harold Jaffe of the Centers for Disease Control, he's an epidemiologist, is in Atlanta tonight. And Dr. Paul Volberding runs the AIDS program at San Francisco General Hospital. He's there with 2 of his patients. We will be calling on other experts and individuals deeply involved with the AIDS crisis throughout this hour. For the record, almost all known cases in the United States have been traced to sexual contact, or to drug abusers sharing infected needles, or to blood transfusions, or it can be passed on to babies born to infected women. The AIDS virus, unknown in human beings until a few years ago, breaks down the body's immune system, making the victims defenseless against infections that they normally would fight off. The cases reported to the CDC since AIDS was first identified in 1981, those cases now number well over 16,000, with more than half of the victims already dead. And just as frightening, at least 1 million Americans, some put this figure as high as 2 million, are infected with the AIDS virus. They probably don't know it. They may never get the disease, but they could infect others. About a third of the people that we polled still fear carrier and casual contact. This question.
Well, there's so much written or heard about, children with AIDS and how they're, stay out of school and everything. What about teachers with AIDS or the cafeteria workers with AIDS?
We're going to have a lot of discussion about casual contact throughout this hour, but Dr. Jaffe in Atlanta tonight, what about that question of public health facilities, cafeterias, restrooms, and so on? Are you at risk there?
We really have no indication that AIDS would be transmitted in such facilities. The best evidence really comes from studies of the family members of AIDS cases. And there, except for transmission between sexual partners and from mother to child, we see no other transmission. So in other settings like schools or businesses where the amount of contact is considerably less, we would think the risk would be even lower.
Thank you, Dr. Jaffe. As I say, there will be more discussion tonight about casual contact. I should also forewarn you that we will be using some explicit language. It is necessary in the discussion of this disease. Only about 7% of the people in the NBC poll say that they have changed or admitted that they have changed their sexual habits because of the AIDS threat. But a vast majority, 83% of those that we questioned, who feel that AIDS will eventually be spread, believe that it will be largely through sexual contact.
Yes, can past exposure from other people that you've been in contact with sexually spread AIDS to your spouse if you're married?
What about that, Dr. Bulberding? What are you learning in San Francisco?
Yeah, one of the tragedies of the disease is that a person can be infected and feel and appear perfectly healthy and be contagious during that period of time. So it is possible, although it must still be very rare for this to happen. We do think it's a thing to be concerned about.
Other often expressed concerns on the part of the general public. There is no vaccine yet, of course, and doctors seem able to do very little for the disease's victims.
I was wondering if they have come up with any new developments to prolong an AIDS victim's life.
This is a disease where we have a significant amount of understanding already of the cause and how it works. And I would give cautious optimism that the longer you're free of medical problems with this virus, even if you have AIDS, there is a possibility, and a reasonable possibility, that something important will be done about the disease at the heart of the disease with a chemical approach and probably a biological approach. I speak of chemicals that directly attack the virus and improve the immune system, and I wouldn't be surprised if major advances in those directions will come in the next few years.
Also on this program tonight, the American Red Cross has set up telephone lines with medical experts in many of your areas to take your calls for the next 2 hours. So if you would just watch the screen in your home for the Red Cross telephone number to call, or that of other organizations and government agencies who want to help. As AIDS cases grow, so do personal concerns. The future of AIDS is already here. Medically puzzling, politically sensitive. How to handle it is a perplexing problem for all of society. The questions, some of the answers, coming up.
You hear people talk about living in a fast lane. I had a very active recreational life and a very intense professional life. And when the brown spots showed up on my leg in December, I knew I had it before the confirmation. I knew December 13th when I realized that's what they told me to watch for. And there's never been a doubt since that night in the shower when I went, oh my God.
That's how it begins. Then there's the terrible waiting, the daily checking for symptoms. Even a common cold seems like it could be the end. 73% of the victims are males with active homosexual and bisexual lifestyles, largely between the ages of 20 and 50. Most of the cases are concentrated in San Francisco, New York, and Los Angeles. In those cities, as many as 40% of those living the homosexual lifestyle are now infected. Yet the gay community quickly got the message about AIDS, and for the most part, it has been the most effective in dealing with it. Richard Dunn is the executive director of the Gay Men's Health Crisis here in New York, and in San Francisco tonight, John Lorenzini of the Peoples with AIDS Alliance. He's had the disease now for 2 years. And Duncan Gwynn, diagnosed as having AIDS 4 months ago. Let's begin with you, if we can, Mr. Dunn. We heard that man talking about the fast lane and an active recreational lifestyle. That has changed in much of the homosexual or gay community, hasn't it?
It was always a small percentage, Tom, and I think it's important to remember that the people that were first infected were the ones the first exposed, and so it's not surprising that those who had a large number of sexual partners would be the first ones to get sick. But when we see people diagnosed now, there really isn't very much difference between the number of lifetime sexual partners they've had, simply because the virus is so prevalent in the gay community that any sexual contact now carries a risk.
But shouldn't those who remain very active and who may be infected be identified in some fashion, singled out, as it were?
I think they need to be identified for purposes of educating them. We assume that everyone knows the facts, and that's not the case. In addition to that, even those who know the facts and aren't changing their lifestyle need to be supported in the changing of that lifestyle, and that can only be done with a massive education program.
And in San Francisco, Mr. Lorenzini, as I understand it, more and more members of the gay community now are using condoms.
Most definitely. It's a very important part of safe sex, and without safe sex, there's no way that we have of dealing with this disease at this point. We need to basically get the education and the responsibility in the hands of everybody to be able to protect the community at large.
And what would be your advice to young people who are coming up and want to lead a homosexual lifestyle?
Be very, very careful. Read and learn. Practice safety.
Thank you very much. The hardest high-risk group to reach, however, also poses the most danger for society. 17% of all cases involve intravenous drug abusers. Too many addicts sharing needles. Years of shooting up have already weakened their immune systems, so they are especially susceptible. Unlike the gay community, the drug subculture has not changed its way of living or dying. Here is NBC News science correspondent Robert Bazell.
Tom, as we discuss AIDS, we hear about gay men's health groups, gay lobbying organizations, campaigns to educate gay men. There are few such organizations or efforts for intravenous drug users, even though they account for about 1/5 of the AIDS cases nationwide. Drug users don't seem to care much about the disease. Many public health officials believe that drug users represent the greatest danger for the future spread of AIDS. In a vacant lot on the Lower East Side of Manhattan, a young man and woman prepare to inject heroin into their veins. They have just bought the drug nearby, and they can't wait to get home before they take it. First, they dissolve the powder into a liquid. Then they draw it into syringes, and they inject it. These addicts know about AIDS and how it can be spread by sharing needles.
Are you worried about AIDS? You're scared to death.
When they inject the drug, they draw large quantities of blood into the syringe to make certain they get all of the heroin into their body. It is because so much blood is involved that the widespread practice of sharing needles has led to a huge epidemic of AIDS among drug users in New York and other cities.
Calling it a catastrophe would be an understatement. We estimate that approximately half of the people who inject drugs in the city have already been exposed to the virus.
In New York City alone, that adds up to 100,000 people infected with the virus because of drug use. The addicts say that because of the fear of AIDS, they try not to share their syringes and needles, what they call their works.
I use a brand new set every time. I never use I won't even share mine with him anymore now.
But they admit when they really need the heroin, they don't worry about it.
When you're sick, you don't care about AIDS. All you care about is getting straight.
That's the crucial phrase, when you're sick. When a drug user is going into withdrawal, he is going to use whatever needle is available. If someone else has used it, he's likely to use it.
Public health officials, including Dr. Desjardins, say that drug users are the most likely people to infect others outside the usual AIDS risk groups.
They are clearly the major threat for transmission through heterosexual contact. Of the heterosexual contact cases in New York City, approximately 90% involve a drug user as the apparent source of the virus.
A majority of the street prostitutes in New York and other cities are drug addicts who could infect their customers. Almost all of the hundreds of children born with AIDS and AIDS-like illnesses have been the victims of drug users. Most have either drug-addicted mothers or mothers who got the virus from a drug-addicted husband or lover. Public health officials hope to begin more campaigns to educate drug users about the dangers of AIDS. But there is evidence that many already know about AIDS and are trying not to share needles. But when they really need the fix, it doesn't matter. One of the main indications of addicts' concern has been that the price of new needles and syringes on the street has gone up from about $1 a few years ago to $4 now. Some officials have suggested that addicts be provided with free sterile needles. But so far, political leaders have rejected those suggestions, fearing that the free needles might encourage more drug use. Tom?
Thanks, Robert. We want to ask our panel of experts tonight about this particularly vexing problem of drug abusers and AIDS. Dr. Jaffe in Atlanta, what do we do? I mean, the drug community always has been very unresponsive to the idea of any kind of order and discipline.
I think it's true that of the various groups with an AIDS problem, the group of IV drug users has been by far the most difficult to reach. I think perhaps we need to really develop novel approaches to get to this group, to say don't use drugs if you can. If you must use drugs, at least don't share needles.
Then there are the other victims of AIDS. 3% of them were blood recipients who contracted the disease through transfusions and babies born to infected mothers. Most of those cases are linked to blood collected before last July when the federal government ordered a new blood test for AIDS. It was, however, several summers too late and of little comfort to some Americans, the victims of chance. A case in point, a 24-year-old Indiana woman received 3 blood transfusions in 1982 for a bleeding ulcer. She was married a year later, and during the same week, in May 1984, she learned that she was pregnant on Wednesday. But on Friday, she was diagnosed as having AIDS.
Hi, I'm Amy Sloan, and I have AIDS. People don't seem to understand what AIDS is all about. I can do almost everything that you can do, raise my little boy, and go about my business just like everyone else. We know a lot more about AIDS than some people give us credit for. Someday we'll even find a cure. Until then, remember that people with AIDS are just like you, except that we have a disease that kills.
And as you can see, Amy Sloan is in Indiana tonight. She's there with her husband. Ms. Sloan, are you bitter about your experience?
No, I don't think I am bitter. I'm angry. I'm angry at this disease, and I hate it that I have to be sick, but I don't feel like I'm bitter.
And how has it affected your relationship with your husband, who's there with you tonight?
I don't feel like it's affected it in any bad way. We had a good marriage before I was sick, and we have a good marriage now. I think that it just makes us love each other even more.
Do you live in great fear, Mr. Sloan?
No. We just pretty much accepted it, and I just don't feel much fear about it. We just accept it.
You have one child.
Right.
And there's been no sign of the AIDS virus in that child who, just turned 1, I guess, this week.
Right. Right. Last week he turned 1 year old, and he's been tested 3 times, I think, and he, all the tests are negative, and he's just doing fine.
One of the leading authorities in the blood area in terms of AIDS is Dr. Jerome Groopman of New England's Deaconess Hospital. He's in Boston today. Are you telling all of the folks that you're talking to up there, Dr. Groopman, that they can be reasonably assured now that they can go to a respectable blood bank and not expect to contract the AIDS antibody?
I think that's correct. The nation's blood supply has essentially been decontaminated to a very high degree, 98% plus, from the AIDS virus. So that transfusion in 1986 is quite safe with respect to contracting AIDS.
Dr. Jaffe, if you were injured in an automobile accident, say somewhere in Texas away from your home, and you were rushed to a hospital and they said that we want to give you some blood transfusions, would you have any second thoughts about taking them from a blood bank, say in a large respected hospital in Dallas?
I would have no hesitation at this point in accepting blood, and I certainly hope that no one would refuse necessary surgery or other procedures because of a fear about AIDS through blood transfusion.
As many as 1,000 Americans are being infected with the AIDS virus every day, according to the CDC estimates. Infection is for life, although most of these people probably will never get the actual AIDS disease, but they could pass the virus on to others today, next week, 10 years from now, for the rest of their lives, unknowingly. In a moment, how much of a common risk are these silent carriers? We reported earlier that the number of Americans carrying the AIDS virus varies anywhere from 1 to 2 million. That's a grim statistic, and it may double in the next 5 years. Doctors right now have no way of knowing who among those infected will get the disease itself and who won't.
The truth is, we don't know how long the incubation period can extend. We know that someone can get infected and have serious problems within a year or two, and then the upper limit has been extended to 7 years or so. The long-term consequences of infection with this virus are still not known, and how long an incubation period it can have before producing disease, my guess would be, can be extremely long, that you might do well 10 and 20 years and still later might get a serious problem as an indirect or even direct effect of this virus.
There are a lot of issues that still need to be studied that would help us understand why some people who are exposed to HTLV3 come down with a disease while others seem not to come down with the disease. There are issues related to the age of the patient upon contact with the virus. There are issues related to the dose of the virus or the route by which someone encounters the virus.
Dr. Jaffe, in Atlanta tonight, a lot of people are wondering out there as they watch this program, I would guess, how do I know whether I have the antibody in my system? What do? Go to their family physician and get a regular blood test?
Well, the antibody test is commercially available, and it would be possible for someone virtually anywhere in the country to get the test. The real question is, should they get the test? I think at this point there is not any general recommendation for people to get the test unless they perceive themselves to be at high risk.
We're going to talk some more now about casual contact and AIDS. We've heard that the virus cannot be transmitted by casual social contact. Most experts also say that there is small danger of it spreading into the heterosexual community. But the public seems to have its toughest time in separating this fact from fiction in both cases.
Can children contact AIDS by drinking fountains, glasses, and such?
I would like to know if you can contact AIDS by kissing, touching, or just being around someone that has the disease.
My concern is how a woman goes about getting it. Does she have to be with a homosexual person? And then if will she get it? If I was to go out with her, would I get it too?
Dr. Volberding in San Francisco, that business about kissing and saliva, a lot of early speculation about the presence of the AIDS virus in saliva. What do we know now?
Well, as you know, there have been reports that the virus can occasionally, and I stress occasionally, be found in saliva. On the other hand, there is absolutely no evidence that that represents any real risk for transmission of this disease. And I think the best examples we can look for are studies where families are examined where one child has AIDS or is infected with the virus, and yet none of the other children, even after daily contact, none of the other children are infected with the virus.
As you know, Dr. Volberding, some mothers are saying that we're not going to allow our children to go to school with another student who is infected with the virus because what if that child bites my child? Couldn't he or she then get AIDS?
Well, I think the problem we have is that people are demanding with this disease absolute answers and absolute protection, and that's not a way we normally live our lives. What I would say is that the risk of that would seem to me to be very, very small in the case of school-age children at least, and that in the case of nursery-age children we do recommend that consideration be made to keeping the infected child out of a group setting.
Dr. Grootman in Boston tonight, you heard that final question about how does a woman get AIDS? Does she get it only from a homosexual, and then if I have sex with her, do I run the risk of getting AIDS? How do you answer those kinds of questions?
Well, I think women are at risk for contracting this virus and developing AIDS through having sexual contact, mainly meaning vaginal intercourse, we think, with either a bisexual man or a man who's used intravenous drugs or someone who's been transfused or the wife or a girlfriend of a hemophiliac. So there's no question that women have contracted the virus through sexual contact. And there are some early data that indicate that men can contract the virus from women who carry the virus.
And how do you counsel the people that you're seeing in the Boston area about how they talk to each other about their sexual relationships, especially casual sex between a man and a woman? Are you encouraging them to be candid one with the other?
I think it's terribly important, given the risks to everyone in the population to contract this virus through anonymous sexual contact, that people be very careful about entering relationships and having sex.
Apart from the scientific research and the scientific symptoms of AIDS, of course, the scourge of AIDS is generating more and more political heat these days. In state legislatures and city council chambers, it is fast becoming the most socially charged health issue of the decade. In a moment, a growing conflict between the rights of a minority and the welfare of the majority. Half the states expect to deal with AIDS-related proposals as legislatures begin the 1986 session. There is considerable talk about mandatory reporting of all AIDS cases and required blood tests, and much agonizing over the question of quarantine. Texas considered one.
All we want to do is medically isolate the person. And someone brought out that we have to keep them until death, and that isn't necessarily the case.
An emotional issue, an ineffective way of dealing with the situation, and something which is very, very frightening to us.
To be blunt, such a policy, and I quote, could not be enforced without the use of detailed sexual surveillance.
Opposition was heated. State health officials dropped the idea. The U.S. Armed Forces began blood testing of recruits last October, but not without challenge.
Does the military of this country have the legal right to discharge these young men simply because their blood tests positive for the HTLV-3 AIDS antibody?
In the workplace, one company put 2 AIDS-suspected employees on paid leave.
We're basically trying to ensure the safety of all personnel.
They're playing the waiting game with me, thinking that it's going to be cheaper in the long run to pay this man every 2 weeks because he's not going to be around that long.
Now what we see is that most of the cases coming in are not from people with AIDS, but people who are perceived as having AIDS for one reason or another. Either they knew gay people platonically who had AIDS, or they had an IV drug-using boyfriend who had AIDS, that sort of thing. And we've seen that perception of AIDS as the fastest growing area of discrimination. Even children who peripherally knew somebody with AIDS were asked to leave school.
Most states, most politicians were reluctant to put much public emphasis on the AIDS issue originally, partly because it seemed to be only a problem for homosexuals and other minorities, partly because its geographic focus was so limited. But now it is an ever-widening circle with questions of civil rights, privacy, and confidentiality. Joining us tonight to discuss these issues are Jeff Levy in Washington. He's a lobbyist for the National Gay Task Force. And in Portland, Oregon, Christine Gebbe, the administrator of the Oregon Department of Health Services. She heads the AIDS Task Force for the Association of State and Territorial Health Officials. Do you think that we ought to have a state-organized reporting list of some kind for people who have AIDS?
We already do. AIDS is a reportable disease in every jurisdiction in this country. That's true for many, many communicable diseases and is a typical public health tool for monitoring what is going on. The question that is still under discussion in a variety of settings is whether, in addition to the disease AIDS being reported, the infection with the virus should be reported in order to enable monitoring of the whole spectrum of the infection. That is true in some states, and I think will become true in many more states over the course of the next year to 18 months.
Mr. Levy in Washington, what do you think about reporting? Do you think that there should be any kind of a master list, whether it's confidential or not?
Well, we've certainly supported the reporting of people who have developed the full-blown disease AIDS. The area of controversy is over whether the HTLV-3 antibody test, those who test positive, should be reported to the state. And the reason that we're generally opposed to that is twofold. One is it will discourage people from being tested for fear that their names will become part of a master list. And the other is because there is no medical intervention at this time for anyone who is HTLV-3 positive other than education. And we would submit that the money spent on testing and tracking and creating lists would be much more effectively spent if it were spent on education programs for targeted at high-risk groups and for the general public.
In San Francisco, Dr. Volberding, do you think that you would have had fewer actual AIDS cases in that community if people had known who was carrying the virus itself?
Well, you have to appreciate the enormous problems that come about from testing. Now, I'm maybe in a minority position on this, but I think there probably is a real role for a person knowing his antibody status or her antibody status to help in the process of education. The problem that we see, though, is that as one comment was already made, at this point we don't have an intervention. We can't really do anything to change that person's risk of developing disease.
Dr. Jaffe, in Atlanta, as you look at communicable diseases generally, we're seeing a very rapid growth now in AIDS cases in this country. As I indicated, nearly 15,000 new cases expected this year. Do you think that the public outcry will grow for more governmental restrictions, for closer monitoring of people who may have AIDS?
Well, I think as the number of cases grow and the perception that AIDS is not completely limited to the so-called high-risk groups, the level of anxiety in the general public grows and the call for the government to take some kind of radical action grows.
If everyone knew about safe sex, about risk reduction guidelines, they could protect themselves. And that's the sort of education, that's the sort of intervention, that's the sort of prevention that's going to be most effective and will not involve trampling on people's civil liberties. There's something I need to respond to that you said a little bit earlier, where you posed a division or placed in opposition civil liberties and public health. Good public health takes into account the civil liberties of those who are affected, because unless you're protecting those civil liberties, you're not going to get the cooperation and the support of the people whose cooperation you most need.
I didn't mean to suggest that they were in opposition to one another. I think it's a question of how do you balance all of them, and that's a problem for society, whether it's public health or laws or education or whatever, and that's very much the situation that we have here. Education is one thing, but what about those people who are out there, and we've heard cases of them, who do have the AIDS virus, may even have the disease, and continue to pursue what has been described as the fast lane lifestyle?
Well, those cases are very few and far between once effective education has been undertaken. And our first line of defense, I'm going to say over and over again, is good, effective education. In those rare instances where someone does behave in a way that threatens other people, there is perhaps a role for some kind of intervention.
Mr. Lorenzini, you have AIDS. Once you discovered that you had AIDS, how did it affect your own lifestyle and how you treated that in terms of how you related to other people?
I really feel like I've emphasized or tried to emphasize some kind of normalcy in my life, or continuing to try to be normal and live a normal lifestyle as anyone else would.
Does that include sexual activity?
Yes, it does.
But you were candid with your partners?
Very much so. I felt that it was an extremely important fact for them to know that I, in fact, had AIDS. And then that I also educated those individuals about what was safe sex and what wasn't. And in many cases, some of the people who I became intimate with didn't always have the know-how about safe sex. So it was my responsibility not only to warn them, but also to make it real clear to them about what was safe and what wasn't.
Pardon me, but were you treated like a pariah once you told one of your prospective partners that you were carrying AIDS, that in fact you had the disease?
Very definitely. But that was part of what was to be expected.
But you're really putting that person at a terrible risk, and isn't that terribly unfair?
I don't feel that way about it at all. I feel that when you follow the safe sex guidelines, that you, in fact, are not putting anybody at risk. And I'd also like to point out that while I do have the AIDS virus, there are many people out there who are showing no symptoms at all who could possibly be even more contagious than I myself.
More questions, more answers about life, death, and AIDS in just a moment.
You watch your friends walk away one by one, and in some cases you watch family members walk away one by one. It's a horrible feeling. I would not wish this on my worst enemy. And, you know, what can you do? If you feel more comfortable being alone, you have to do what's more comfortable for yourself. Sometimes you feel like being with people and they don't feel like being with you. And it's a scary feeling sometimes, but still one must never give up hope.
A lot of them want to talk about death, and they can't do it with their family members or their lovers because that supportive network can't handle it right now. So they'll talk to the nurse, and he or she has that opportunity to be there to support this person.
I can't do anything for them. I can't really, and I can't fix it. I can't make it better. I can't make it go away. But really what I can do is be there.
That's the human side of AIDS. Dr. Grootman in Boston tonight. What about the people who are caring for AIDS victims, watching young people die left and right, day after day after day? Is there a burnout factor for them?
I think it's very difficult emotionally. It's clearly most difficult for the person who has AIDS. But the emotional strain is felt by the nurses, physicians, everyone who encounters the patient, someone who's 25 or 30 years old, previously healthy and really in the prime of one's life, to sound a bit trite, but it's real, is afflicted with a really horrible disease with fevers, recurrent infections, a disfiguring cancer, and usually dies a premature and often, unfortunately, an uncomfortable death. It has a tremendous strain on the physicians and nurses taking care of these patients.
I know you're a trained physician, but has it been especially difficult for you as well because you have been living with it 24 hours a day, I guess?
I think it's very difficult. Being an oncologist, a cancer specialist, I had some background in caring for people who have terminal illness, but not really in this age group. And I think it's important, despite the emotional strain, to really fight and to try to help patients, to do research, to devise new strategies for treatment, and for patients who are really not eligible for this treatment, or patients who are in the terminal phase of the illness, what was said before in terms of being there and being supportive, I think is very important in helping someone with this disease.
The more scientists learn about AIDS, the more complex it seems to be. There is evidence that it can invade the brain cells, for example. This is a computer scan of the brain of an AIDS patient, damage plainly evident to medical eyes. The theory is that the virus may have been dormant, maybe for years before striking. This is the same patient 4 months later. The prognosis now hopeless, even to the untrained eye. This patient died a month later. Doctors first became suspicious when certain neurological conditions cropped up in AIDS patients that couldn't otherwise be explained: mental disorientation, depression, impaired memory and judgment. Dr. Broberding in San Francisco, are we about to see a whole new generation of people who are somehow demented as a result of AIDS?
Well, of all of the clinical problems that face us, it's one of the most challenging and frightening ones for those of us seeing large numbers of people with this virus infection. As we talked about earlier in the program, we don't know what's going to happen 10, 15, or 20 years after the virus infects someone, and we see a very real possibility that many of the people who are now still healthy will have ongoing infection of the central nervous system. And it just adds another hurdle for us to go over in developing effective antiviral therapies for these patients.
The proof that the virus which causes AIDS gets into the brain actually came from Dr. Gallo and his coworkers. And I think that refocused the kinds of therapeutic strategies that we need. I think all of us who are now doing new drug research based on this important lead will be very uncomfortable with at least therapeutic strategies which do not provide some mechanism of getting effective agents into the brain, crossing what is called the blood-brain barrier. And I think armed with that knowledge, we can do a better job. And I think that several agents that are now under discussion on an experimental basis have that capacity to cross the blood-brain barrier and get into the brain. And I think that that allows us to do a more focused kind of approach for developing new therapeutic strategies.
Thank you, Dr. Broder. Although most AIDS cases are in the United States, it's also a growing international concern. 18 countries listed almost 4,000 cases. Leading scientists think that the virus originated in Central Africa, where AIDS is a major problem. NBC News science correspondent Robert Bazell, who incidentally is the only Western television correspondent to have visited Central Africa for a first-hand look at AIDS, has this report for us tonight. Robert?
Tom, there have been few official reports from African governments about AIDS, even though the disease is epidemic in several areas. The governments are afraid of losing trade and tourism. But AIDS in Africa is important for several reasons. It is becoming a major public health problem in some countries. It is spreading there among heterosexuals, and that could tell us what might happen here. And studies of the origins of the disease might help find a cure or a vaccine. These are AIDS victims in Africa. Patients at the regional hospital in Brokaw, Tanzania. The town is on the shore of Lake Victoria, just south of the Uganda border. This is the area of equatorial East Africa, where AIDS has become an epidemic in recent years, infecting people in Uganda, Zaire, Rwanda, Burundi, Kenya, and Tanzania. During a visit to the tiny hospital in Brokaw, I was told that just as in the United States, the incidence of AIDS here has been increasing dramatically. The patients here, like this 23-year-old woman, complain of symptoms different from those of American AIDS patients. Usually they have intestinal disorders and rapid weight loss. Dr. Clinton Nariankume, like his counterparts in the United States, can treat the symptoms, but he can't cure the disease. The results are the same.
Most of them we see like this one, they come and they present like this for 1 year. Sometimes they get better, we discharge them, they go home, but they'll come back later, and then they expire.
This 19-year-old single woman has come to the hospital because she suspects she has what the natives call slim disease, what the doctors know as AIDS. There's a big difference with AIDS in Africa. Here it is a disease primarily of heterosexuals, infecting as many women as men. The evidence points to transmission, not by insects, not by cultural rituals, not by needles, but by heterosexual intercourse. Doctors say that the victims are reluctant to discuss their sex lives.
But we get an impression that a single young lady in this environment will be promiscuous. We think so. Because she's young, she's single, and she is not employed. And so we think she might be having more partners than they tell us.
In some areas, the AIDS virus has already infected 10 to 20% of the entire population. Because of the extent of the disease in Africa, many American scientists say AIDS originated here, a concept which angers Africans, who say the rest of the world is trying to blame them for the disease. But researchers say the best evidence is that a harmless virus which infects the African green monkey mutated to become the AIDS virus. And they say studies of the history of the virus in Africa may help find a vaccine. A major question is, if AIDS is a disease of heterosexuals in Africa, why isn't it spreading more rapidly among heterosexuals in this country? So far, researchers have found no good answer. But we would be very complacent if we assumed that what is happening in Africa could not happen here. Tom?
Thanks, Robert. Let's ask Dr. Gallo now about that very question. If it is happening in Africa, what should we know about what is going on there, and what is the application to the United States? Dr. Gallo?
I don't know how much of analogies we could make from Africa because we don't have enough detailed information yet. Really, we don't know enough details to say that exactly what happened in Africa could happen in the United States. I would say that I see no reason that anyone should be panicking that the virus is spreading rapidly in the heterosexual population. That is just not true, and you've heard it said by everyone, and I would agree with that. That it can go heterosexually, I believe, is established. But I suspect if medical science doesn't intervene adequately and no other change occurs, population density or the way we live, that there'll be a very gradual increment in the heterosexual population, and then maybe in 50, 60, 70 years it would be a significant heterosexual problem. I don't imagine it's going to be a significant heterosexual problem in the very near future.
The laboratory battle against AIDS doesn't look so helpless and hopeless if judged by the distance already traveled and not just the distance to go. We want to talk about that now, about where we are going from here and how far we have come. Dr. Gallo, when you mentioned earlier in the program that we are making real progress, are we just making death easier for AIDS victims? Are we making the process less painful than it might have been? Or are we seeing the real possibility of developing a vaccine, a light, if you will, on the horizon?
We think during the coming year, we'll see the first evidence of what I would like to call an effect or a dent on this disease. I speak not yet of a cure, but of a real effect on the virus that helps people with the disease. I don't think we need a miracle. I think what we need is continued hard work, a few more creative ideas to get over a few more hurdles, but that one can understand the etiologic agent now. We can grow it. We understand its genes to a certain degree. We understand a great deal of how this virus kills the critical cell of the immune system known as the T4 helper cell. We understand even something of the molecular mechanism already. Regarding a vaccine, There's a great deal of activity going on now. I don't think anyone is in a position to predict a vaccine will be effective next year or in 2 years or 3 years, but I do think that in the coming year or two we are in a position to be able to say, yes, a vaccine is likely, at least in a limited population, and likely to work without toxicity in X years by next year or the year after. Let me rephrase that and summarize it. Sometime in 86 or 87, I believe science will be in the position to answer your question as to when a vaccine should be available. The answer might be not for a long time, or it might be in a few years thereafter. There's enough ongoing work now that makes me state that as my best guess of what's going to occur.
Dr. Callow, let me ask Dr. Krupman, if I may. Are you getting enough money to do the kind of research that you need to do, Dr. Krupman?
I think that after an initial period when there was very little money for research and even less money for education, Congress appropriated funds. I'm very concerned about the Graham-Rudman Amendment and the cuts both in the programs based at the National Institutes of Health as well as the cooperative programs. There have been a number of articles in the paper recently, and no one knows exactly what will be cut, but what is being threatened are educational programs, which I think are terribly important, and also some of the moves to have multi-center treatment trials for patients with AIDS.
Thank you. And remember, if you have questions about any of the information in tonight's program, there should be a telephone number at the bottom of your screen. You can call the American Red Cross or other health agencies. Phone lines have been set up so that experts can take your calls. We'll be back with more on life, death, and AIDS in a moment. To all of you in Washington, in Atlanta, in Boston, and in San Francisco tonight, thank you very much for what has been an enlightening hour. We all know a great deal more about AIDS and what lies ahead so far as we can tell at this point, and we are appreciative. We hope that you have learned tonight as well. We have all heard again and again and again tonight, the bulk of medical evidence says that for most Americans, the risk of getting AIDS is minimal. If you are heterosexual and don't live a freewheeling lifestyle involving sexual experimentation or promiscuity, if you don't shoot drugs or have sex with people who do, your chances of getting AIDS are 1 in a million. The chances are greater that you could be killed in a car accident or, in America, even murdered. AIDS, if not stoppable, can be slowed down now by changing sexual behavior within high-risk groups, by a careful screening of the nation's blood supply, or by getting the message to drug users. In the meantime, however, people continue to die of AIDS in ever-increasing numbers. All of us, of course, hope that there will be a cure or a vaccine. But, for the moment, education and caution are the only vaccines. I'm Tom Brokaw. For all of us at NBC News, good night.
Life, Death, and AIDS is a production of NBC News, which is responsible for its content.